A lot has changed over the last 10 years with respect to research and where we're understanding pregnancy and preconception for women. And certainly there's been a lot more research into understanding nutrients and how they work, both in the growth of children and also in the development within utero and how the mother experiences things. And we certainly understand that there are a number of key deficiencies that she can present with before she conceives her child that directly influence the potential to conceive, potential to miscarry, and the health of the child forevermore. So when we're looking at a mother and we're looking at the microbiomes within her body, obviously she has a microbiome in every single aspect of her reproductive system, but specifically her vaginal microbiome directly correlates to the health of the child as it's growing. When we supplement with probiotics and we give her probiotics, we're actually able to completely recolonize the environment by choosing specific strains, which can optimize the pH of the vagina, which can optimize the health of the baby as it's growing, the health of the childbirth and the delivery, and eventually the initial fingerprint that child receives, which is essentially their microbiome for the rest of their life. So as research has evolved and we're starting to understand the microbiome and its implications, specifically when we're looking at gestational diabetes for women during pregnancy, we know that if she experiences gestational diabetes, it directly relates to the growth of the child in utero, how large that child will be, and that's termed macrosomia. Not only can gestational diabetes cause diabetes in the mother if it's untreated and unmanaged, equally it can cause carbohydrate digestion imbalances and a precursor and a risk factor for obesity in our children. But we understand now that by moderating and stabilizing the microbiome of the mother, we can both protect her from developing gestational diabetes and then obviously improve the health of our children. We didn't have an understanding of the microbiome 10 years ago the way we do, and it's incredibly essential that all women of reproductive age essentially take probiotics, and then they can help to assist in a healthy delivery of their child.